like to know who's joined us today. We're also going to be utilizing the chat box for helpful links throughout the discussion. I would encourage you to put your questions in the chat box. We, throughout our time together, will attempt to really answer those questions, but if they're not answered, please know that the Children's Trust Alliance will be sure to get an answer to you. I'd like to thank the Quality Parenting Initiative, the Children's Trust Fund Alliance, and Casey Family for their support with this panel and the development of the tools that we will introduce today. We have come together for a panel discussion and comments from the Children's Bureau to introduce a new building relationship tool. And we're going to ask that you utilize this tool and to disseminate it nationwide. This tool is so important, as we know that the more support.
You know, that's like somebody who don't want to do it.
All right, so let's just take a moment to ask folks, Shonda, to let's go ahead and take a moment, Sharonda, to ask folks to stop their video and to mute themselves so that we can reduce the amount of background noise.
What was that? Who said that?
Sharonda, you're on mute.
Hi, we're going to ask everyone to please turn off their video. Please mute yourself. We want to reduce as much background noise as possible. I'm going to go back and talk about where we're at with the tool here. What we want this tool today, we're going to want you to look at disseminating it nationwide. This tool is really important as it will let you know ways to support families. And the more that we're able to support families, the more likely they are to reunite. Our objective is to build strong and sustainable relationships that not just only support children's development and their well-being, but really support all of the individuals that actually touch a child well-being case. The building of the Birth and Resource Parent Guide is designed to do just that. The tool was developed in collaboration with parents and caregivers. In our hour discussion, we're going to hear opening remarks from one of my most respected leaders, Jerry Milner. Jerry has really been a longtime friend of the Children's Trust Fund Alliance. And if you have not heard Jerry speak, you're really in for a treat. I, on multiple occasions, have had the opportunity to join Jerry on many panels. And what really sticks out about him with me is his genuine heart to really hear from those that are most affected and his commitment to incorporate that insight into policy change. We are seeing communities and states being motivated and they're activated about this proposal, and having the support on a federal level is the synergy that we actually really need. Second, we're going to hear from Robin Robbins and Jody Rogers. A little bit over a year ago, I first met these two as they educated a group of us about how to build a relationship. And I was really struck by their love for one another. It far outreached the confines of just supporting Jody's children. At first, I heard firsthand how they supported each other. I hope you'll be as inspired as I was through my initial introduction to these two amazing women. When we then hear from Leslie, and I met Leslie about a week ago for the first time by those that had known her best. And I have to tell you, by the time they got done talking about this extraordinary leader, I wanted to know more about her and actually was thinking about moving to California. Leslie truly boldly embodies the values that you will see throughout this guide. And they've done this before this tool ever even existed. This trio challenged the status quo. I think sometimes the system, it puts us at this us and them. It's divisive. It is a we. We need to daringly transform the culture. So home account leadership is undoubtedly a jurisdiction where we can take notice. As we prepare to start with Dr. Milner's remarks, I'd just like to share a
Rhonda, we lost your audio just as you were getting ready to introduce Dr. Miller.
Okay. right, do you have my audio?
Yes.
Okay. Sorry, as you guys can see, there's a bit of technical difficulties. So I'm hoping that you will capture parts of my remarks. I'm going to go back just to make sure. I was talking a little bit about bringing in Dr. Milner's remarks. But before I do that, I'd actually like to just share a story of why I believe it is vital to building relationships. In my prior position, I had witnessed a really working parent who had worked really, really hard, and she is successfully reunified with her children. As I introduced the importance of the children maintaining relationships with the family that the children had known for over 2.5 years, the parent clearly stated to me, they know my children, they don't really know me. So why start now? I was really struck by that because I really knew a handful of reasons why. Because your children shouldn't experience a loss when such a celebratory event has happened in their lives. They've already really gone through so much. Because you're going to need support, and who better to support you than those that have cared for your children? Because we can all do this better together. And lastly, family doesn't have to come from blood. It can come through strong bonds built. And your children have definitely built some strong bonds. Let us not just support children. Let us please support and wrap ourselves around family. We are truly all responsible to each other to set an environment that support those that in times of crisis cannot necessarily see beyond their immediate needs. The more that we create these opportunities for each other, the more that we care for one another, the stronger we as people and communities. And I don't know about you, but I think we could really use a whole lot of that right now. I'm going to turn it over now for some opening remarks to my dear friend, Jerry.
Okay, I am trying to, hopefully you can hear me. Thank you so much, Sharonda. It's just always so wonderful to be on the same program with you, wherever we are or whoever we're talking to. It's great. I'm only going to take just a very few minutes here because I really want you to hear from the other experts on the panel today. But I wanted to open up just with a few remarks about why it seems so important that we have relationships between resource families and children's parents be front and center as we think about reshaping our foster care system in this country. You know, we have met over the last 3.5 years with parents, resource parents, young adults with lived experience in the child welfare system in probably about 40 states at least. If you count the virtual meetings in over the last few months, it probably easily goes up to all 50 states and some territories as well. But when we hear some of the experiences that our families have had out there, it shapes our view of how we are serving them, and in many cases not serving them in ways that we should. And it has and will continue to translate into policy decisions that we make. You know, one of the things that we routinely hear is that it's just all too easy for parents to lose hope when their children have been removed from their homes. It's so easy to feel like the entire world is against them and that they may not really have an opportunity to reunify with their children and to maintain those critical relationships that are so important in their lives and in the lives of their children. And even if they don't lose hope, many of them lose invaluable time with their children that is critical to the healthy development, to the brain development of children that they can never regain again, no matter how long they have. We know from science and research that the more extensive the contacts are and the relationships between children in foster care and their parents, the greater the likelihood of reunification and the faster reunification occurs. We also know that any removal is traumatic in the life of a child, even if it's absolutely necessary to protect the safety and well-being of that child. Just earlier this morning, I was on another call where a resource parent was recounting the story of having a young girl about 11 years old come into her home several years ago. And the trauma that young girl experienced, the silent sobbing of that child for having to be removed from her mother, even when it was really impossible during that time for them to live safely together. And that resource parent went on to tell me about how she engaged with that mother to make it less traumatic for that child. And I think this is the opportunity that we have right now. We can't always take away all the trauma of removing children from their homes, but we can make it less traumatic. Taking an approach where resource families and children's parents are working together to show children that not just one parent or one set of parents cares for them and loves them, but that multiple people want them to be successful and are working together in order to make that happen. This can have the effect of strengthening the protective capacities of parents in so many circumstances. Without taking up a lot of time, I think in terms of pictures and I think in terms of stories. And I just wanted to take a minute or two to share with you a story that totally changed my view on the relationship between resource families and children's parents that happened more than 25 years ago when I was still working in a state child welfare agency down in Alabama. And I had the opportunity then to visit a neighborhood foster care program up in Brooklyn, New York, where the standard way of doing business for children who had to come into the foster care system was first to place those children in the same community, the same neighborhood where they lived, so that they didn't have to give up all that was familiar to them, their relationships, their friendships, their connections to schools and recreation out there. But second, the expectation of that agency is that the children's parents and the resource parents would immediately become acquainted and that they would work together in a co-parenting or shared parenting model to care for those children. I had the tremendous pleasure of sitting down with the parents that were involved in one of those circumstances where 3 children had to come into the foster care system because of chronic substance misuse on the part of their mother, making it at that point unsafe for them to be able to remain in her home. Almost from the get-go, the resource parent was introduced to the children's mother and began somewhere along the lines of saying, okay, I want to tell you what our schedule is here. In the mornings, we will be walking to school around 7:30 or 8 o'clock. I'll look for you then. To come around and help me walk the kids to school. In the evenings, we'll be doing homework at, I don't know, 5 o'clock, 6 o'clock. And after that, we'll be having getting the children ready for bed. So I'll be looking for you to come around and to help with those kinds of things. And the list went on of the expectation that this mother would continue to carry out as many of her normal parenting responsibilities and opportunities as was possible, even if she could not have her children under her roof full time at that point. Those children remained in foster care for 2 years, which is a long time in the eyes of a child. It's a long time for all of us. And the mom had many ups and downs in her battle with substance misuse and her attempts to get treatment. But still, that resource parent was always there for her, encouraging her, supporting her. And whenever she was able to be in the home and to provide parenting to her children, the resource parent supported her to do that. Over time, the resource parent actually became an advocate for this mom, helping her to get some of the very essential things that she needed in order to regain custody and full-time parenting responsibility for her children. And after a 2-year period of time, those 3 young children walked back up the street to their mother's home. And the beauty of that story is that the relationship between the resource parents, a resource parent and the children's mother didn't end with the reunification. She remained in her life as an ongoing source of support. Just hearing that story directly from people who experienced it helped me to understand that that can be the model for foster care in our country. Since that time, I've had an opportunity to see a lot of other examples of that, not nearly as many as I want to see, but the fact that you're having this meeting here to talk about this, and the fact that you've developed the tool to promote out there gives me incredible hope that we can, in fact, collectively move our foster care system much more into the direction of a co-parenting, shared parenting model whenever that's possible out there. And I applaud you for doing that. And I thank you so much for just giving me a few minutes here to share with you why I think this is just so critically important to all of us. Thank you.
Thank you so much, Jerry. I so enjoyed hearing that story and just the power of people and relationships and what we can do for each other. I wanted to turn this over to Robin and Jody. They're going to actually spend some time talking about the guide and the recommendations. We have 2 beautiful people that have definitely had their own experience, and we'd love to hear from you, Robin and Jody.
Thank you, Shonda. This is Robin Robbins, resource parent from Northern California, the place where fires grow, I must say. But I'm thrilled to be here, and thank you, Dr. Milner and David, for your continued inspiration and support, because as Shonda said, that's part of what's kept me going all this time, along with the support of these amazing agencies and all the leaders out there and all of you in the audience, because we're all here for the same reason. And Jody, my esteemed partner and beloved friend, and I have been working for the last 3 or 4 years along with this national project in our own community to try to implement these relationships in the cases that we were working with locally. And we've worked pretty hard and long, haven't we, Jody, to try to make this happen. So the tool is very exciting. We now have something written in hard copy or virtual that we can show people that talks about the exact work that you just described in that case, Dr. Milner. So it's very important, and it's very exciting to be here today to introduce this tool. And you know, we often talk, Jody, I'm going to ask you to sort of describe about how Jody and I actually are a model for how this relationship can work. I'm a foster parent, resource parent, she's the birth parent. And just to let you know, Jody, let folks know a little bit of what it was like when you first met me and how you felt about me in our very first meeting. You want to share that story?
So when Robin and I had first met, she had found out that there was parent mentors in our county. So she went out of her way to find us. And I just remember at that moment, I was still fairly new as a parent mentor and really freaked out about foster parents. And so when I had first met Robin, it was my supervisor who introduced us, and they did a little role play of like a birth parent and a foster parent introduction. And I was absolutely just freaked out by her, like taken back. I remember feeling like I need a way out of this room as fast as I possibly can. And I think I even at one point got up and left the room. So I couldn't get away from her fast enough.
So fast forward to now, where I won't make a decision without running it by this amazing woman first. And I think she pretty much touches base with me too on a variety of subjects, not just child welfare questions. So I'm really proud to be here with you, Jody, and we are going to talk about this guide, but keep in mind for all of you that this guide was actually written by and with the guidance and recommendations of people with lived experience such as Jody and myself. So that's part of what gives it its, you know, its real authenticity to help support these relationships. And much of what Jody and I have done, you can find steps to use in your life and in your experiences in this tool. So it's pretty exciting. I'm gonna talk a little bit about the tool. I'm not gonna read much of it because you'll have access to it, but the relationship building guide is organized with, probably next slide, please. It's organized in 4 distinct parts. We're not gonna read each of these, but there's a little bit written about each one. There's a tool there you can use if you're training with this or if you're just trying to learn the information yourself. So we'll give a little bit of an example of each of the topics. The first one, near and dear to my heart and Jody's, is to get this relationship started as soon as possible. And if we follow through with the transformation of the system, maybe before children are removed would be my dream, but at least at the very beginning of a case. So Jody, maybe you can explain a little bit how we did our first pilot program. I take medically fragile infants into my home. We had already started this partnership and learned to work well together. So I called Jody and I told her I had an infant in my home, and how were we going to start creating this relationship from the very beginning. So you can tell that story, Laura, about Laura, how just quickly how we met, right, and your part in it. Yeah.
So after Robin and I had started to build our own relationship and partnership, like she was mentioning before, and we're blessed enough to where we work in a county where we have management that totally supported us and backed us, and we were given the go ahead to work on a pilot case. So when Robin had let me know that she had a baby in her home, I got the referral for that mother. And so when I met her at her very first detention hearing that morning, I was able to approach her in a way I was never able to approach another birth parent before. So I was able to let her know, I know where your child is, and I know that your baby is in safe hands. I personally know and trust this amazing woman. And I was able to really let this mother know that her baby was in the hands of someone who, her passion in life was about healing families and was really wanted to be a part of healing families. And I just remember in this specific hearing, this mom was up for, she was eligible for bypass. And this wasn't her first child that she had removed. And I just remember, like, she just bursted into tears and she just said, thank you so much for sharing that with me. And when we got to set up the first visit and arrange the first visit, the very first time that Robin and this mother got to meet, as soon as Robin came out of the car with the baby, this mom ran up and just wrapped her arms around Robin and just said, thank you so much for all that you do.
That's right, Jody. And that was just the beginning to what is still a very close and wonderful relationship with many people on the team for this family support. And I think the thing that I sometimes want to remind my fellow foster parents, although they probably know, just remind all of you, is there's so much for me to get back in a relationship with a birth parent. I actually feel like I'm on the receiving end of all the amazing things I'm learning. So without Jody, I wouldn't have learned perspective. I've learned empathy, and I know what to do next to help support the children in my care. So that was the first step. The other 3 topics, the second topic, we continue to support it in this particular case, but we've had many other cases. We've had challenges and successes, but we call these little moments that just make us almost cry, partnership moments. So do you remember when in terms of supporting the relationship as we go on? For me, that looks like good communication and, like I said, empathy and perspective, and getting as much of that as we can with as much contact as we can during visits, virtually, with the meetings that are happening, whatever way we can to actually get contact. But Jody, I think you had a story about a family that we had heard there was a problem that the birth parent wouldn't talk to the foster parent. Actually, we were saying the word hate. She said she hated the foster parent. So we came in as a team of support And what was beautiful about this story, I'll let you share more, Jody, was just what it took to really build the relationship was us all getting into the same room and caring about each other. So go ahead, Jody, share a little bit about that time with Katie and how she turned around and the whole case turned around because of that relationship.
So I was working with a mom who she really disliked the foster mom, and she had a lot of like pent up feelings. So what we did was we all had a big meeting about like what's going on and what can we do to work through this, and how can we really make this we'll say resource family and this birth mom a partnership. And so through my work with mom and through Robin's work with her mentee, who was the resource parent, we were able to come together and just really kind of figure out what was going on for them. And so at one point we had a big meeting, and I was there as voice of birth mom, and I could really hear what was going on. And I was really able to hear the resource parent talk about, like, it's time, like this little boy misses his mother. Like every time I take him from a visit, he's throwing shoes at my head or toys at my head. And so I was able to go back to birth mom and explain to her, like, this, like, you can call her a foster parent or a resource parent. I know that the language is changing, but she's really in your corner. She's really rooting for you and for your son. And so what Robin and I did was we said, what will happen if we bring them both in a room together and we all sit down and we have a heart to heart and we just all really humanize each other and listen. And so when we sat there, I was there to support birth mom. Robin was there to support the foster mom. And as soon as they sat down, it was almost like Robin and I weren't really even needed. We just kind of faded away into the background, and birth mom was able to say, like, I'm terrified that you're going to take my place in my son's life. And the foster mom looked at the birth mom and she goes, I want to be honest with you. When I stepped into this, I was terrified to work with birth parents in recovery. I didn't know what that would be like. I've never really experienced anything like it, but I'm watching from the background how hard you're working. I'm seeing all you're doing in this program, and every week you're shining a little bit brighter. And it was, I just have chills just talking about it, but it was just this beautiful moment where they really got to be human to each other. And just by the end of the meeting, like, they were in tears and they were hugging each other and laughing about the things that the little boy likes to do and sharing details with each other about the little boy. And so from that moment on, how cool was it? This little boy got to see both of these parents working together and really just transitioning him together. And that really grounded him in his transitions. And it really turned out beautiful, because I remember the moment where we had a transition meeting to transition this little boy home, and everybody in the room was in tears, because as they were talking about the transition home, the resource mom was really on board with, well, he has a doctor's appointment. Why don't we do this together? And then when they talked about his day home, and when birth mom realized that that was her birthday, she said, well, why don't you keep him that day so that you guys can have that special day together and he can come home the next day. And I remember the foster mom or the resource parent just thanking her and being so grateful.
Yeah, that was one of those partnership moments that happened many times in that case. And I think, Jody, you and I are pretty lucky to have experienced, we've experienced and watched and guided people through a lot of pain, because this is a painful and traumatic situation. But we have had the joy of watching people learn to love each other. And that's the word we don't always say, but that's the word that matters in children and families, is learning to love each other. And we've been able to experience a lot of that in return along the way. So the 4 topics can help guide you through what we think is a natural sort of progression of how to guide and support families. But keep in mind, no matter where you are in a case, no matter what's going on, if you see a need for some people to have an opportunity to work together, that these topic areas can be used in any order. But the next one talks about keeping the relationship strong. And then the last one talks about what I think, Jerry, was really important and I think is a real missing piece and not talked about much. We talk a lot about the end goal being reunification, but really these families don't stop when the day reunification happens. And in my experience, almost that's where the support needs to start for families. That's where families really need to get back on their feet after this traumatic experience and working with the system. And hopefully we've all been a team and worked with them and advocated them throughout the system. And like Jody said, our child welfare office allowed us to really be part of that process and be part of the team. But then when we get to reunification, all of a sudden people disappear. Who's there to help the family? And then the other situation is it's not necessarily about whether it's reunification. So we've developed a really wonderful way of looking at a case as it moves on. And sometimes we start building relationships at this point. But Jody, explain a little bit about, you know, what brought you to this place of having our great saying at the end of a case, and just how you got there. You can pick a story or a family, or just talk about it.
So I just want to say, like, I think that when we're talking about partnership, that we really focus on, it's never really about how a case ends, right? Like when we think about partnership, the idea behind it is that as long as it's safe, that every child deserves to keep everybody in their lives who they love, whether that be moms, dads, foster parents, aunts, uncles, other children that they have built these bonds with. The idea is to really foster all of these relationships so these children are keeping everybody in their lives. And I really feel like that is the core of partnership.
Okay, and then I think the other thing we want to make sure you hear is, before we go on, is that you're the people who can do this work, that everybody's involved as a team member. And we really think that the work of this team that we've built nationally and statewide and community for ourselves has really inspired a culture change. We really see it happening. And now we have these tools to make it happen. So moving on to the next slide, it just talks a little bit about the intended audience, excuse me, that you would naturally assume to use this tool for. But I'm going to ask you all to think a little bit further than just using this tool with a birth and a foster parent situation. Absolutely needed there, but be innovative. Think outside of the box. Think of other places we can have this conversation about relationship being so important to keeping families strong and to getting them back on their feet, and even to mitigate the damage we do when we remove a child and go through that traumatic process, and how it's never ending. We need to continue these relationships and this support and this guidance. And I think that as we finish up here, Jody, I'm going to just say the thing that I feel very supported in by you, Jody, is my ability to be listened to and heard and not look like I'm, you know, somebody there just to do damage to your family. You have that skill of really wanting to hear what I have to say. But more important, I think what our work in partnership has done has reminded the staff and the child welfare folks and all of you out there in the audience that what families need is to be heard, and what we need is to be respected. And once you do that, I think some of the time the solutions that are needed come from families themselves. So I'm super excited about this tool. Please take it, share it everywhere. I'm going to be doing a training at the local community health center during their staff meeting. So I'm going to be talking to medical providers about this. We're going to try to get our judicial team involved. And then also, Jody, I'll let you talk a little bit about when you came into this. I'll let you finish up with when you came into the system and how that connections you made then were so important.
Definitely. So I want to say, like, part of a successful partnership, kind of like we were saying earlier, is finding your champions and finding the people in your child welfare system who really support you and do a lot of, they do this work through their heart and through passion. And so, and we were blessed to have found, like, Robin and I partnered together, like, we went to Leslie and we said to Leslie, like, this is what we want to do, and she has really supported us. So along the way we've had like where we've gotten stuck, but we've always been able to reach out. We've always been able to go to her for help. When we've started to feel like our partnership was struggling, we've always really been able to go to her and say, hey, this is what these are our challenges. Can you help? And she's always like right there to listen. So we found our champion within our child welfare agency who really genuinely works from her heart. And so something I want to share is that while I am a birth parent mentor today, the way I became a birth parent mentor was I was once a mother who had her children removed in the child welfare system. And that's something that's in your core, and it's something that never goes away. Like it lives inside of you, and the feelings and remembering that is something, it sticks with you. Even when you go from being a client to a professional, it does stick with you. And I will never forget the moment I went into Leslie Winter's office, who's a manager at child welfare. And we were having a conversation, and I was talking to her, and I was like explaining to her something that was going on. And I was like, I feel like I did everything right. I went to all of the higher ups. I went, and when I was explaining it to her, she goes, Jody, I want to explain something to you. And she really she took me by the hand and she said, there are no higher ups. We are all equals. We all have very different roles and very different jobs. But at the end of the day, we are all equals, and we are all doing this from our hearts and for the same reasons. And that's to help families. And I remember looking at her, and that's something that has really stuck with me. And it has changed the way I work and the way even I view myself, because while we all have very different roles, we are all equals, and we all do just really want to help families. And so with that, I want to say that I just feel so blessed for the partnership that we do have.
In our own community. Yeah, thank you, Jody. And thank you, Leslie. And thank all of you for listening to us. The hardest part for Jody and I is to stop talking, because we have a robust amount of wonderful experience. We have a good number of opinions on what barriers are in the way too, but really the takeaway is this is about building relationships. And we're just asking folks to put them back where they belong, in families, in family systems, especially with today's world and the trauma that's going on and the extra barriers that we all have, to think in terms of communication and empathy, and really just thinking about love. So thank you for your time today. And please take these tools, look at them, get creative, share them widely, use your own ideas, and really we can make this happen. Thank you.
Thank you so much, Robin. We're going to turn it over to Leslie.
They're not administratively set. Yeah, okay. Because they didn't really prepare for it.
Okay, thank you. I appreciate the introduction, and hopefully I can live up to it. So first of all, welcome everyone. It's really exciting to see participants from all over the country. So thank you for being here. I am thrilled about the launching of these tools, and in particular the leadership guide. And I want to thank everyone on the call today, but particularly the Alliance and Robin and Jody for sharing, why this is so near and dear to their hearts, and really how they have the courage to come to Sonoma County leadership and to make this happen. And so we are thrilled to have the tools, thrilled to have the guide. As Robin and Jody have really beautifully articulated, the whole goal of the guides in all levels is to support counties and jurisdictions in nurturing and facilitating birth and foster parent partnerships. And so I want to talk a little bit about kind of how the guide is designed, and then I'm going to really spend most of my time talking about our lessons learned and the way that we've changed our culture in Sonoma County. So as you can see on the PowerPoint, it is divided up in 5 sections. First is, this first section is really the rationale for why it's so important, and you just heard some of the why. In terms of benefits to children and families, You know, these partnerships do support the overall well-being of children and their families and contributes to positive outcomes. And I'm going to talk a little bit more about that as well. Section 2 really addresses the key elements of agency culture that must be in place for successful implementation and how to support that culture. Section 3 focuses on 7 specific practice recommendations that birth and foster parents have made to agencies that are implementing these co-parenting relationships. Section 4 describes a series of field-informed promising practices and policies. And then Section 5 is tips for sustaining implementation. So that's kind of how it's broken up. And so you can also see on the slide who the intended audience is. What I'd really like to spend my time talking about is really how we did this in Sonoma County and how we made this happen. And so a lot of the credit does go to the Youth Law Center and to our Quality Parenting Initiative. We have been working for a very long time to change the culture, and culture change does take time. But really it's been the inspiration of our families and now our birth parents and our youth mentors that have really changed the way that we do business. We have begun really creating forums so that we can listen in a different way to our stakeholders, to our birth parents, to our foster parents, to our youth mentors, to the consumers of our child welfare system, to really learn how it needs to be shaped. And we in California have implemented child and family team meetings. In Sonoma County, we've been actually providing those venues for families to come to the table for over 5 years. And so engagement and how we engage is really how we've changed the culture. And people like Jody and Robin have influenced that change by inspiring us and sharing the stories about why it works and allowing us to really, for them to really teach us and change the way that we lead and the way we listen. Some of the benefits to children and families, this co-parenting model allows the child to heal rather than being drawn into the conflict, including the conflict of loyalty, which we all know exists. It allows for higher quality visitation. We know that visitation is one of the highest predictors of reunification. And so it allows for a higher likelihood of reunification, which is our goal. It allows foster parents to better understand how to care for the child in their home by listening to the parents. And so those are just some of the huge glaring benefits of why it's so important as leaders that we listen to our families. In terms of culture change, we have spent, as I said, time in terms of listening, by seeing what is possible, by creating forums that included foster parents and birth parents, and for at all levels, and starting at the top, because we have our director of our local Sonoma County child welfare organization is a huge believer in the power of these relationships, and that has trickled down to me as a manager, to our supervisors, to our staff. And it's something that has required us to, it's not a one and done. This culture shift requires constant attention, constant training, constant work. And we have built it into our foster parent training for new foster families. We've built it into our new hire orientation. We've included the testimonials from all of the different roles. We have engaged with our foster parent leadership and with our birth parent and our foster and our youth mentors in ways that we had not before. you know, over time, and it did take time, our challenges and, you know, our conflicts became less adversarial, where we were just really coming to the table to talk things through. And really, what it came down to was trust and respect. You know, creating integrated teams that included different roles from all levels. It changed our values regarding engagement. And so just keeping in mind as leaders that this is really about listening, values, and around a different level of engagement. But in terms of benefits to the agency, what it means is that we're going to see higher reunification rates. We're going to see more teamwork to support case plan goals. We're going to see less conflict and less, you know, investigating erroneous allegations and complaints. It could even lead to less work for case managers, quite honestly. I've seen in some of the, even in the quotes in the guide, that some case managers had commented that when we're teaming better and when foster parents and birth parents are working better together, there's less work for the case manager. There's visits that are happening more seamlessly. There's more investment in that transition to get children home. And it's really reducing fear and trauma for all involved. So, you know, in terms of promising practices, I want to again give this credit to Robin and Jody, who had the courage to pilot this in Sonoma County, who, you know, they got us excited with their passion and it got us inspired. And we are now turning our pilot into sustainable practice. And this guide at all levels, but especially the leadership guide, is going to help us to get this into sustainable practice, to build our policy, to develop an advisory group. And we're just excited to have these new tools to guide our process.
Thank you so much, Leslie. And as you just shared, these tools are needed. They are complementary of one another. And what I really heard is that we certainly need the buy-in from statewide leadership for this to be really effective, and that the Sonoma model is something that, you know, we as a nation can certainly take notice of. I want to turn it back over to Jerry and just look at if you have any recommendations, future considerations for jurisdictions.
Okay, there I go again. Okay. Well, thanks so much. And what a treat to be able to hear from all of you about why this is so absolutely critically important. What I am hearing you say is that this really is about a culture change, a shift in the way we think about what foster care really is intended to do. And more than that, what it really can do if we put our minds to it. I love the references to reducing the trauma and supporting entire families here, because that goes to the heart of why this is so important to us. One of the things that I left out of my opening story about the foster care agency is that when I had that opportunity to meet with the resource parent and the children's mother and hear about their experience, I was so bowled over that this could actually happen in a foster care setting. And later I asked the director of that that agency, you know, how in the world have you accomplished this? How do you have resource families who are willing and want to do this? And how do you foster those kinds of relationships? And her simple answer to me was, that's our expectation. Just that. That's our expectation. I'm not naive enough to believe that we can automatically create an expectation and get there, but we do have to create that expectation if we ever expect to get there. And at the Children's Bureau, we are trying to create that expectation going forward. We have not an awful lot of discretionary funding that's available to us, but where we have had discretion, we have focused it in a couple of different areas. One, as all of you I think would be familiar with, is in our primary prevention efforts, because we would like to support families before they ever have the need to be in contact with the Child Welfare Agency. But in some other areas, we've used our discretionary funding to support a reimagined child welfare system or foster care system where resource families and children's parents do work together very closely. I want to mention just 3 or 4 of those real quickly here. We, beginning this fall, will be funding a national quality improvement center on family-centered reunification, where in several sites we will be promoting a very comprehensive, holistic, family-centered reunification process in which foster care programs and families serve as a support to, not a substitute for, parents and children's broader families. We want to use this funding opportunity to help support children achieve as much normalcy as possible in what is essentially an abnormal situation, which is foster care. We'll be producing a number of products, including webinars, an online course, video series, and we'll disseminate our findings from that effort very soon. We also are funding will be funding. We've just put out a forecast to let the public know that this is forthcoming. We haven't actually issued the funding opportunity announcement yet, but an initiative is called Improving Child Welfare Through Kinship Supports and Foster Care as a Service to Families. We expect to award up to 6 grants across the country when we make the formal announcement here, which will focus on greater use of kinship resources for children who must enter the foster care system, and to improve those experiences with kinship families, much the way that we hope to do with other resource families who are not necessarily related to the children. We have another effort that we funded in last year, in fiscal year 2019, which is called our Center for Excellence in Foster Family Development. This was originally conceived of and funded as a way to increase the pool of resource families out there available. We took it a step further to say we are interested in having not just more resource families, but resource families who are absolutely committed to working with children's parents and families to provide that level of support that we've been talking about here on the line, and to develop those resource families in the neighborhoods, in the communities, so that children, as we mentioned earlier, can maintain those critical relationships and make it possible for their parents to be in regular contact with them during their stay in foster care. The last one that I'll mention, just as an example, a couple of years ago, we also awarded a series of grants to strengthen the child welfare outcomes for families involved in the child welfare system. And one of those grantees down in Austin, Texas, is actually developing a practice model that will help child welfare agencies engage with children's parents better in planning and decision-making, building those critical partnerships with resource families, and generally increasing the sense of being cared for and being connected and being belonging for any child or young person who has to enter the foster care system. While these funding opportunities won't of themselves get us all the way to where we want to go. We believe that they will actually be very big steps in that direction and help us to institutionalize some of this vision in our policy, our programs, and our practices as we go forward. The last thing that I'll mention, and I believe that this is available to you somewhere in the what's on screen here. Earlier this year, about 5 or 6 months ago, we issued federal guidance and information memorandum on the critical importance of having relationships and partnerships between resource families and children's parents. We cited examples of that, and we laid out our case for why we think that this should be a national goal in child welfare. If you haven't had a chance to take a look at that, it is on our website, and I believe you've got a link here. So we strongly encourage you to do that.
Gary, it is in the chat box. We did provide it. Okay.
Great, outstanding, outstanding. Well, that's it for me. I just want to thank you again. It's just been incredible to be able to be a part of a discussion here around something that's so near and dear to us in the Children's Bureau, and to hear your perspective. So, thank you.
Thank you so much, Jerry, and I hope that everyone will join me in thanking all of our panelists for their incredible insight and inspiration today. Special thanks to the Children's Bureau for their commitment, particularly around reunification. I like to use the word reunification parent, that we are all here seeking the same common solution, which is we want children to be home, we want children to be well, and we want our communities to thrive as we continue to work with one another to build each other up. Once again, if you could quiet or mute. I want to just point out that the link in the chat will be, the PowerPoint will be in the chat. We also will have the evaluation in the chat, and that there is a one-pager, and I know that we all like kind of nice condensed documents to highlight the key points, and so we actually have a one-pager that we would also ask that you take a look at. I'd just like to end by a nice quote by a good friend of mine. And she said, take a chance on change, and change to give us all a new chance. I hope that you will take this into your jurisdictions, that you will challenge the status quo. I did see in the chat box that there were some questions around, you know, dealing with the frustration and resistance in certain jurisdictions. This work is not easy. It must be done. The importance of us really building each other up and walking through this sometimes incredibly difficult system. We are in need of one another desperately. So please go back and be that person that brings up the conversation and decides that you will be the change agent in your community, and that you will bring a voice to our children and to our parents and to each other. I want to thank the Casey. I want to thank Quality Parenting Initiative, and I want to thank, once again, the Children's Trust Fund Alliance. We have resources if you're interested in those. And I just want to thank you all for joining us today.
Sharonda, if anyone, this is Meryl Levine, and if anyone has questions that they want answered, then, and they're in the chat box, we will follow up on those questions after the webinar today. So I just want to make sure everyone knows that. And if they want links to resources to help with some of the programs that they might be trying to develop, here is the listing of the resources that people can email, or they can email us through the chat box and let us know, and we will follow up.
Thank you so much for that, Meryl. And with that, we will say goodbye to all of you.
Yeah, I wanted to just say thank you to everyone, Jerry Milner, you, Sharonda, as well as our great panelists, Robin, Jody, and Leslie. Thank you all for a great presentation today, and have a wonderful day.
Thank you.
All right, be well. Bye, guys.
Bye.
Bye-bye.